Hello again, everybody. Thanks for stopping by again. Just wanted to give a quick little update. This won't take long because I really don't have that much good information anyway. So I went and did my throat scope, and everything went really well. Didn't wake up with a sore throat or anything of that matter. So didn't really expect the procedure itself to be a problem. I was more concerned with what they might find in the procedure. And so far, to give a little recap, so the GI doctor took about 3 or 4 biopsies, I think. She noticed that there was a lot of swelling and irritation all along the esophagus and even into the stomach. Basically, a irritation of the stomach lining. So that can be common with long-term use of painkillers, they say. So in the esophagus, they found what they call EOE, which is basically an irritation of the esophagus that is caused by an allergic reaction. So they wanted to rule out any food related allergies or basically just get me to do an allergy test to figure out what it was that was causing all the irritation. Essentially, I guess your body sends a bunch of white blood cells there like it's trying to fight an infection, but the infection isn't necessarily an infection. It's more just an allergic irritation. So went to the allergy doctor, did those tests. They basically prick you all along your back, up along your shoulders, and turns out that I'm allergic to basically everything in my southeastern USA environment. Different types of ragweed, grasses, trees, pollen. Fortunately, no food related allergies, so that's a good thing. Fortunately, it doesn't look like I'm going to have to change my diet. Unfortunately, it looks like the cause of the EOE and definitely my sinus problems that I've had over the years, it's in the environment around me, so not much I can do about that. Now, the other unfortunate thing was the day after I got home from the allergy test, I started to feel kind of like a overall whole body soreness, like like what you'd normally experience when you're getting the flu or something like that. So I thought that maybe I was getting sick and just kind of toughed it out, took my vitamins, figured I'd be sick for a few days and no intervention otherwise, just get better, just fight it off like normal. The problem is in my neck, shoulders, all through the incision area where they did my surgery, but primarily in my lower back, kind of like my glutes, my thighs, my hip more or less, down into my calves and even my ankles. It's like my muscles are so incredibly tense that I can hardly even move. Uh, Imagine for me if I used to go do a giant hike, like a 6-7 mile hike straight up a pretty steep mountain. The next day I'd be pretty sore, and it kind of hurts to walk, sit down on the toilet, things like that, bend over, tie your shoes. That's basically what it is, but it's so painful to the point where I can't really find a position to get comfortable in. If I try to extend my legs out straight, or if I stand up and walk, or try to, bend over and wash my legs in the shower, things like that, it feels like things are so tight that they're like about to tear. And this was all coupled by migraines as well, just terrible migraines. So last night, yesterday, I spent about 8 or so hours in the emergency room, and they gave me some things that helped with the migraine, but didn't address this tightness, the soreness. They were just kind of confused. They did some blood work, lots of blood work. They took, I think, eight or nine different vials, and nothing came back terribly out of the ordinary. So it's kind of frustrating to sit in the emergency room all night and not really have much of any improvement. But today, here in about an hour or so, I'll get to go to a orthopedic specialist, and hopefully that they can give me something, because I've tried Tylenol, ibuprofen, Aleve. I've tried icing. I've tried heat therapy. I've tried icy hot. I've tried like the Salonpas patches. I've tried everything, and nothing will get rid of this achy, sore feeling. So I have no idea what that is. I spoke with the allergy doctor. They said that, you know, something like that could be common for up to 24 hours after you take your test, but nowhere near this long. This has been like 7 days now. It's been 7 days now, so not sure what's going on there. So unfortunately right now, update wise, I really don't have much else. I will go back and do another throat scope in a couple months, which actually, this all kind of brings me into one topic that I did want to cover that I don't think I've really talked about much yet, is painkillers, especially opioids or any painkillers that you're on. It wasn't really told to me that this would happen, but I definitely experienced it many times, and it's quite the phenomenon, especially if you're not prepared for it. When I was on my initial dose of painkillers that I left the hospital on, I stayed on that for, I'm wanting to say 2 to 3 months. After 2 to 3 months and I got into the pain management doctors, they cut that dose down to a slightly smaller dose. We're talking, I went from 10 milligrams down to 7.5. It doesn't seem like that's really much of anything significant, right? It really doesn't. Right before they cut that dose down, they cut it down because they thought that my tolerance was kind of taking over, and I was becoming tolerant to the medicine, and its effectiveness wasn't quite as much. So I noticed that the duration of each pill was not providing relief, like in between. It was only giving me a couple hours to maybe an hour worth of relief each time I'd take a pill. So they cut it down to 7.5 milligram, and when they did, for the first probably a solid week, it was this horrible feeling, kind of like I had the flu. It was like, seriously, like you have a terrible flu, not necessarily sinus drainage and things like that, but the body aches, the chills, the fever, things like that were so common as my dose was being cut down. And they say that it's more or less like a feeling of withdrawal. So your body was used to a certain amount, now you're giving it less, and it kind of goes into this reaction. So if you're in a situation where you're on painkillers, especially opioids, they say that the sooner you can get off those things, the better. It's absolutely true. Don't take them just because maybe, oh, I hurt a little bit, or I don't want to hurt. Don't take them for that. Pain is, after something like what I had, it's going to be there, period. But if you're taking it unnecessarily, you're not doing yourself any favors, because you're eventually going to have to come down or come off of it, and it's going to be absolute hell when you do. It was a straight week of basically sweating bullets, my entire body feeling so achy that I couldn't hardly move, and I had no energy whatsoever to do anything. I think I just slept for practically a week. So unfortunately for me, even to this day, nerve pain, muscle spasms, all these things kind of happen, and it's unavoidable. I still have some pretty weird, pretty intense pains in the surgical site even to this day. So it's unfortunate, but I've had times where I don't really have to take much, and when I feel like I don't need to take it, I don't. I just stay away from it. It's uncomfortable, but it's a necessary evil, so be prepared for that. But anyway, hopefully the orthopedic session today will go well. I certainly appreciate everybody's thoughts and prayers. It means a lot to me. And by all means, these videos are not they're not easy to do. The earlier ones were good. Again, I never intended to share any of these, but I'm glad that people like myself and my wife and friends would take recordings, because I wanted to remember what was said. I wanted to be able to look back on these and kind of sort everything out in my mind in what order that they were in, because my memory was so bad on all those drugs that without the videos I wouldn't have been able to recall everything all that clearly. Naturally, it seemed like something I needed to shed some light on, so I kind of gathered everything up and made some videos and put them out. And that was easy, but now it's not easy because I don't feel like I have all this exciting material to cover. So by all means, if there's questions that you have or something you want to know, please ask away. I'm happy to answer. That's what this is all about. That's what I'm here for. To shed light on something that I feel like practically has no coverage whatsoever on YouTube. You can Google it. You're not going to find much of anything, at least from the patient perspective. So this is the whole reason why I wanted to talk about it and why I wanted to make these videos. So feel free to ask away. Until next time, I'll see you later.